So Mary, you're here today after your ankle surgery that I did. Um, how many weeks or months it's been since I did your surgery?
It's been 2.5 months.
2.5 months. And you had a very unusual condition, and that's why I asked you to actually do this testimony, because something like this is not necessarily I encounter in my practice every day. And if it's okay, I'm going to be a little bit more specific just because of how unusual your case was. You had an extra bone in your ankle called ostrigonum in the back that was basically giving you a lot of discomfort.
That's correct.
And we did the non-surgical techniques. I mean, we've tried cortisone shots, anti-inflammatories, bracing. We've done it all.
Yes.
And it just was not working out.
No.
So 2.5 months ago, you got brave enough to let me go ahead and go in and remove that bone.
Yes, we did.
And well, tell me, were you in a lot of pain after the surgery?
Not as much as I thought.
Mm-hmm. Did you take pain medications?
Yes.
Okay. And how long did you wear that boot, the gray boot that I gave you?
The first boot was only a couple of days.
Mm-hmm.
And then we went with the wrap.
Mm-hmm. The wrap. And then you had some physical therapy done, right?
Yes.
Mm-hmm.
12
sessions.
sessions,
Mm-hmm.
yeah.
Mm-hmm. So you're 2.5 months out. What do you think?
It's still healing,
Mm-hmm.
but it's doing great. I'm almost back to walking normally,
Mm-hmm.
and I would do it again.
Mm-hmm. So was it worth it?
Yes.
And the amount of pain you had before the surgery and the amount of pain you have now, how would you describe it?
The pain I had before, I couldn't walk very well. I would limp, and I'm almost back now to where I don't limp anymore. So it definitely was worth going through the surgery, and I'm starting to feel great.
Good. And remember I told you that, I mean, for this type of procedure, it does take a little bit longer than some other procedures just because of the nature of the injury.